What's going on, everyone? Happy Saturday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Pandemic Update for the first Saturday in June, June 1st, 2024. If you're new to my channel, this is where we do the daily Pandemic Update on all things COVID, any other virus that could be a health threat to you, and of course we also talk about climate change at about the halfway point of our videos. Today we're going to take a look at several news stories. We're also going to take a look at some data, which some of it is data we did not get to show yesterday, and something we have not looked at in a really long time that I did not know still existed. After doing a quick search today, I found, oh, okay, we can still get data from the UK. So let's take a look at that in a little bit. If you're new to the channel, subscribe to my channel down below and remember to hit that notification bell. The more regular followers that watch my videos every day, the more YouTube will push this content throughout the algorithm, and of course the more likes we get down below by hitting that thumbs up button, the more YouTube will hit this out throughout the algorithm as well. Let's try for 125 like button hits today. Share this with anyone you know and leave a comment down below. Starting off today, we do have an update from JY Infections increased modestly again this week, up 10%, more aggressively in the Southwest. NWSS data only since February of 2024. As you know, or maybe you don't know, BioBot did discontinue their public data reporting, so unfortunately we cannot show you that, and you can see here on the chart we are starting to see a rise once again. And if we take a look back at the past few years, spring or the end of the winter wave, that tended to be the lowest levels of the year. Only time will tell if that's going to be the case this year, or if we go up and drop, or whatever happens going forward. There is some modeling saying that we will go up and then stay flat, not drop, and then go up even higher later in the summer. We'll have to see if that ends up being correct. Modeling so far is correct on the rise that we are seeing right now. Taking a look at what's happening in Australia, or in specifically Victoria, Australia, there are 361 COVID-19 patients in the hospital, more than double the 170 patients who were hospitalized with the virus at the same time last month. 21 of those patients are in intensive care, with 8 on ventilators. So yes, that is still a thing. People still go into the ICU. People still do go on ventilators. Maybe not as high as what we were seeing back in 2020, but hey, it is still a thing. In Oregon, whooping cough cases increased 770%, prompting OHA to encourage vaccines. Yes, if you have not gotten your child vaccinated for whooping cough, or maybe for some reason you yourself as an adult is not vaccinated for it, it's time. Go out and get a vaccination for it, because whooping cough cases, they are continuously rising in many different places around the world and right here in the U.S. COVID-19 virus concentrations steadily increasing in Colorado wastewater. Just reading a headline here. We did see Colorado's numbers this week, and they are starting to rise somewhat. Not a major rise, but they are on the rise. All right, now we have a post on X from Mike Honey, and he says, here's the latest variant picture for the United States. Now, I'm not quite 100% certain how they get this data when the CDC has not done the every other week update yet, but they do have access to it. I don't know how to get the access to it, but the point is they do have the data, and here's what they are seeing. Flirt lineage, KP.2, has been dominant but might be under challenge by Flirt JN1.16.1 and FLUQE KP.3. KP.3 variant is something that is causing the bigger wave that is being felt in the winter months. Mind you, it's winter in Australia right now. KP.3 is what's going on there. JN1.16.1, don't know a lot about that yet. I haven't seen much about it. Maybe I'll have to do some research and find more about it, but the point is, these variants are on the rise, and they could eventually overtake KB.2. Moving on to this now. COVID-19 cases on a downward trend again. This is for Ohio. So Ohio did see a rise, and now all of a sudden, Ohio is seeing a drop again. They're pretty much bouncing around at this point. And the rest of the Midwest also is not actually rising just yet for COVID. Cleveland, Ohio, after last week's slight tick upward, the number of new COVID-19 cases in Ohio resumed falling from 953 last week to 890 this week. A drop is a drop. It's not a big drop. It's not really telling us what's going to happen going forward. I mean, they could easily go right back up again next week. They could drop a little more. Again, we are in uncertain times, so anything could happen. The new case number has fallen for 14 out of the last 15 weeks. So they only did have 1 week where they rose, which actually that is not a bad thing. That's actually some good news. The state also adjusted the number of Ohioans who have received at least one dose of the updated COVID-19 vaccine by adding people who were previously excluded. At least 1.3, we'll just say 1,367,951 Ohioans have received the updated one-dose COVID-19 vaccination. Alrighty, moving on to this now. Actually, let's stay with this for a second. There were 48 Ohioans newly hospitalized in the last week, raising the total since the beginning of the pandemic in 2020 to 151,574 people who were hospitalized for COVID, and 4 people were admitted into the ICU, bringing that total number since 2020 to 15,816. All right, moving on now. Taking a look at this, something I did not know was still in existence. Apparently, it updates 4 p.m. on every Thursday. Now, not 4 p.m. Eastern Standard Time, but in the UK. Yes, the UK still does update. And there are a couple things here, or several things here, I want you to take note of. In the past 7 days, their cases have actually dropped. However, deaths with lag cases and hospitalization with lag cases also did go up. But I must remind you of something. The U.S. has not been following what's happening in the U.K. anymore. We used to, then we broke away from that. Will we at some point go back to following that? I sure hope we will, but I also want to show you something else. See how cases have started falling? But you can see in the hospitalizations, it's very clear in the hospitalizations, cases are a huge undercount. Yes, they easily could be falling right now. I would agree, maybe they are falling right now. But hospitalizations, which lag it, you can see here, the increase in hospitalizations was a bit more steep. And again, it wasn't a lot of hospitalizations. There's 156 people in the hospital. But again, it's indicative that there were probably far more cases than 1,820. That number could have been double or even triple that amount. And also, again, we've got to take a look at this chart. We can see in the past, like last year, their lowest levels were in the spring. And then they went up. And then they stopped going up, then they went up again, then they stopped going up, then they went up again. You get where I'm getting at here? The baseline was higher each time they started going up again. So we'll have to see what happens going forward. Hopefully they will go down. I would like to see them go down, but I'm not going to make any predictions as to where they will head. All right, moving on now to today's pollen levels. Taking a look at the national allergy map. 40% of the country is in medium status. There is some red up in New Hampshire, and there is some red being shown in Oregon, where pollen levels are a bit higher. Anywhere that's in the orange or red, or even yellow for that matter, it's time to be taking your allergy medicine. Make sure you take your Legler. I take mine every day, and I'm reminding myself I need to get more pretty soon because I'm starting to run low on it. All right, taking a look here at today's air quality levels, and we can see the air quality over the Great Lakes. We do find ourselves in some yellow and some oranges, and some of that yellow does spill down into Tennessee, Alabama, and it looks like you do have winds out of the south again in Texas because we do have the oranges starting to pop up. Not as many reds as last go around, but there are some oranges, and California in the Bay Area and just south of Sacramento. And then down in southern California, we are seeing some oranges and a lot of yellows, meaning your air quality, it's not great. Taking a look at heat-related illnesses. We expect the heat-related illness map to continue to fill in as more places start to experience excessive heat. And we can see here, in California, it's been increasing. In Florida, it's definitely been increasing. And it's also on the rise in the Northeast as well. When we come over here to the National Weather Service, we can see, let's go back to the hazards map first. We can see here that there are excessive heat watches now up for portions of California, southern Nevada, and northwest Arizona, where heat index values could go 100 to 105 degrees, which means heat-related illnesses are going to happen more frequently. Heat-related strokes, heart attacks, breathing difficulty, dehydration. Make sure you are drinking plenty of liquids if you are in those areas. Taking a look at today's severe weather threats, there is an enhanced risk of severe weather today across portions of Kansas and Oklahoma, and then a slight risk from Texas on up all the way through to Nebraska. Be mindful if you live in those areas, and please take all warnings seriously. Want to learn more about climate? I have another place where I do that. It is on X, formerly known as Twitter, at Climate Data Report. Just type in Climate Data Report in the search bar, and it will come up. Taking a look at EMS calls in Philadelphia for yesterday. 774 EMS incidents were reported on Friday. Taking a look at what's going on in Montgomery County, Pennsylvania right now, and we can see there are a few calls, about 10 calls earlier, and we'll see if this is still the case. And it still is. Chester County is very busy right now. We do see that some of this is for EMS standby, but again, I'm seeing cardiac arrest in Parksburg Borough. Stroke is popping up, seizures, sick person, heart problems. There's a lot of different calls right now, so it is busy for ambulance calls in Chester County, Pennsylvania. Let's take a look at Walgreens for this week, and the national positivity rate is 18.6%. It's been steadily rising for several weeks now. It is up 1.1% this week. Taking a look now up in Canada at what is going on for wastewater. Number of sites showing an increase, 15. Number of sites showing no change, 31. Number of sites showing a decrease, 16. One site is now high, 7 are moderate, 15 are low, and new sites. There are 39 new sites at this time. All right, taking a look at some CDC data, and we can see here epidemic status. It is growing and likely growing in many places now. Maryland, Florida, Texas, New Mexico, Arizona, California, Nevada, Washington, Wyoming, Alaska, Hawaii, all in the growing status. Likely growing now in Connecticut, likely growing in Virginia, South Carolina, Georgia, Louisiana, South Dakota, and Utah. All are likely growing now. It is likely declining in several states as well, such as Delaware, West Virginia, Mississippi, Kansas, Iowa, Wisconsin, and Michigan. And it is declining in Oklahoma and Minnesota. Always a good thing to see it dropping in Oklahoma, because Oklahoma has the highest long COVID rate in the United States as of most recent reports. And remember, this is a reminder, it only takes for you to come in contact with one person to make you become infected, and then that one infection can lead to your case of long COVID. Avoid infection altogether. Wear a mask. It's the easiest way to do it. Just put an N95 mask on when you go out into the public or into indoor settings, and it should help you stay safe and keep you from getting infected. Matter of fact, there was a new study just this past week that shows N95 masking prevents almost all COVID infections in people who are wearing them. Yes, it really does work. All right, taking a look here at CDC variant tracker, we can see KP.2 on the most recent CDC update was 28.5%. And then KP.3 was up and coming at 12.7%. And then, of course, there are a whole bunch of other variants below this, which was the other one that we were talking about a little bit ago. That is the JN 1.16.1. Let's go back here. Let's see where that ranks here. JN 1.16.1 as the most recent CDC update is at 5.4%. Taking a look at New Jersey, and we see hospitalizations in New Jersey. Good news, did go down today. 177, 69 out of 70 hospitals reporting. 6 people are on a ventilator at this time. New York State update yesterday. They had 1,029 cases added. Some of that could be a backlog from the day before. It would not be the first time that has happened. We have seen before where Thursdays, for some reason, will come in low, and then Friday comes in with a much higher number. Not the first time, won't be the last time. Will be interesting to see if they have another day next week over 1,000. Remember, New York State does not update on the weekends. Taking a look at their hospitalizations, 524 people in hospital, 39 people in the ICU. Taking a look now at what is going on with Los Angeles, California, and we can see their hospitalizations. Take a look at this. Not really rising all that much, pretty much just flat. Their deaths, they did have a little rise, and now they're starting to drop once again. And look at this, their cases. They just saw an ever so slight decrease. They're not seeing that many daily average cases. Anyhow, it is higher than what it was back in April. But again, it's just seeing a slight decrease. And if you take notes here, back at the beginning of May, it was going up, then it dropped, then it went up again, then it dropped. So can't really read much into what's happening there. They're pretty much just bouncing around right now and testing. Of course, the positivity rate did go up ever so slightly. It is now up to 3.36%. There are other parts of California that are rising because overall wastewater is rising in the southwest region of the U.S. Of course, we will have our full wastewater update tomorrow. And real quickly, I wanted to show you something on the website. We did finally add those just the other day. We did finally add two new sections, one for RSV and another for pertussis, whooping cough. It was time that those two sections got added, and I think as we head towards the rest of the year, or second half of the year, there'll be a lot of RSV stories added. Right now, it's summertime in the U.S. RSV is not a big issue, but, it is an issue right now in other parts of the world. And, of course, whooping cough is something that continues to evolve. We do know over in the U.K. and England, they are seeing a ton of cases of it. Here in the United States, it's popping up as well. Alrighty, folks, that's really all I have for today. Again, tomorrow will be the wastewater update. As for going forward, we're pretty much just in a wait-and-see period right now. We'll have to wait and see what happens throughout the rest of the summer. At any given time, anywhere in the world, a brand new variant could just pop up out of nowhere. So who knows what's going to happen. Hopefully you enjoyed this update today. If you did, give it a thumbs up. If you want to see more content like this, subscribe down below, and remember to hit that notification bell. And of course, share these videos with anyone you know. And of course, leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Saturday evening. Thanks for watching.